Welcome to the Banish Cancer channel. I'm your guide, Sarah, and today we're talking about one of the most exciting breakthroughs in cancer treatment, dual antibody immunotherapy for multiple myeloma. If you or someone you love has been affected by this disease, you know how challenging it can be, especially when it becomes resistant to treatment. But new research is giving patients real hope. Let's start with why this breakthrough matters. Multiple myeloma is a cancer of plasma cells, and while treatments have improved over the years, some forms remain incredibly difficult to treat. One of the toughest is extramedullary myeloma, which spreads outside the bone marrow and often stops responding to therapy. But in 2025, researchers uncovered something extraordinary. A Mayo Clinic study found that an off-the-shelf dual antibody therapy produced deep and durable responses in patients with this aggressive, treatment-resistant form of the disease. This therapy combines two engineered antibodies, talquetamab and teclistamab. Each one targets a different pathway, and together they recruit T cells in two distinct ways. Think of it like giving the immune system two separate GPS signals that both point directly to the cancer. This dual-target approach forces T cells to attack myeloma cells more effectively than ever before. Researchers described the responses as powerful, especially in patients who had exhausted nearly every other option. But that's not the only breakthrough. At the 2025 ASH conference, experts highlighted how bispecific T-cell antibodies are transforming multiple myeloma treatment. These therapies bind to both T cells and cancer cells at the same time, bringing them together so the immune system can directly destroy the tumor. And innovation is accelerating. Johnson & Johnson announced early results from a trispecific antibody that targets three antigens at once: BCMA, GPRC5D, and CD3. In early trials, this therapy produced an impressive 86% overall response rate in heavily pretreated patients. These are individuals who had already gone through multiple lines of therapy, often with limited success. Another promising combination involves talquetamab paired with pomodomide. In the MONUMENT-TAL2 study, this duo produced deep and durable responses in relapsed or refractory multiple myeloma patients, even after long follow-up periods. That consistency is important because it shows that the immune system can stay engaged over time. There's also the tec-dara combination, which pairs teclistamab with daratumumab. In a major Phase 3 trial, this combination made patients 83% more likely to remain alive without disease progression compared to standard second-line therapies. That's a huge improvement for people who have already relapsed. So what makes dual antibody immunotherapy such a game-changer? First, it's off the shelf. Unlike CAR T therapy, which requires collecting and engineering a patient's own cells, dual antibody therapies are ready to use. That means faster treatment, which is crucial for aggressive disease. Second, they target cancer through multiple immune pathways at once. Cancer cells are clever; they can hide from single-target treatments. But when two antibodies attack from different angles, the cancer has fewer places to hide. Third, these therapies are showing deep, durable responses. That means not just shrinking tumors, but keeping them under control for longer periods. Of course, like all treatments, dual antibody immunotherapy comes with risks and side effects. Cytokine release syndrome, infections, and immune-related reactions can occur. But researchers are learning how to manage these effects more effectively as trials expand. The big takeaway is this: for the first time, patients with the toughest, most treatment-resistant forms of multiple myeloma are seeing real, meaningful responses. And with trispecific antibodies and new combinations on the horizon, the future of myeloma treatment is brighter than ever. Thank you for watching the Banish Cancer channel. I'm your guide, Sarah, and I hope today's video helped you understand the incredible progress happening in multiple myeloma research. Share this with someone who needs hope, because when we learn together, we grow stronger.